My name is Guilherme Dabus. Welcome to Link 2019. I'm Interventional Neuroradiologist at Baptist Hospital in Miami. So that's a very good and it's a very important question. When we're dealing with aneurysms, mostly like the small aneurysms, they have a very low risk of rupture, right? So depending on the occasion, those aneurysms still may need to be treated. For example, we have patients with family history of intracranial aneurysms, a young patient on that occasion. Some specific locations have higher risk of rupture. If the aneurysm has like 5 millimeter or 4.5 and it's irregular, all those features may increase the risk of that aneurysm bleeding, and we don't know that. And you're dealing with a risk that's going to take it's a lifetime risk. So if you have a patient that's like 45-year-old and has a 5 millimeter aneurysm, which is asymptomatic now on the anterior communicating location, posterior communicating location, in my opinion, those are aneurysms that should be treated. We have great ways to treat them with very low risk of morbid mortality. So why wait and give the chance of that aneurysm rupturing in the future, which even knowing that there's a small risk, if the patient's 40 years old and he's going to live until they're nowadays 85, 90 years old, you have a long risk of that aneurysm potentially causing a problem. So depending on the occasion, patients that have history of aneurysms or different aneurysms that had ruptured in the past, those are, in my opinion, really cases that should be treated. I think the holy grail of our specialty in the future will be trying to identify, since aneurysms and ruptured aneurysms are very common. You find them very 2 to 5% of all scans that are done for other reasons you may find an aneurysm. So the main thing will be really trying to identify which unruptured asymptomatic aneurysm, a small one for example, that really has a higher risk. Are we going to have any imaging or biomarker that we're going to be able to identify which aneurysm is really at risk to rupture? So I think that's that's a very important question. We don't advocate treating all aneurysms that are smaller than 5 millimeters. For example, an older patient with a 5 or 3 millimeter aneurysm definitely should not be treated, because the risk of that for until the end of their lives for that aneurysm causing a problem is very, very small. So it's more likely that we would hurt that patient trying to perform a treatment than really the natural history of that aneurysm for the rest of that patient's life. But a younger patient, again, with risk factors, family history, history of subarachnoid hemorrhage from a different aneurysm, irregular aneurysm, and some locations such as anterior communicating, posterior communicating region, basilar tip, those are definitely have potentially a higher risk of bleeding. So in that case, a younger patient, in my opinion, is very justifiable, and it's in the patient's best interest to have that aneurysm treated.
Well, thank you very much for your insights, and thank you for coming to Link.
Thank you, it's my pleasure.